This is dedicated to preventing eye injuries and vision loss and saving children's eyesight. 1 of 20 children ages 3 to 5 has a vision problem that could result in permanent vision if left untreated. Having a month dedicated to knowing about your child's eye health and safety can make a big difference to your child's health and life. According to India TV, only 46% Indian kids get regular eye tests. From a survey, air pollution can cause excessive rubbing of eyes, resulting in weak vision. Hereditary is also a root cause for kids suffering from myopia, which can affect their performance and development in the long run. On an average, 23 to 30% kids in India are affected with myopia, especially kids residing in urban areas, as they are seen spending less time outside under sunlight. We at Medicircle are conducting a series on Children's Eye Health and Safety Awareness Month series to help raise awareness about vision diseases and eye conditions in children, as well as how to prevent them. Hello, I'm Aprajita Mehra, and today our guest for the talk is Dr. Saumya Saxena. Dr. Saumya Saxena is a consultant cataract and refractive surgery in Indira Gandhi Eye Hospital. She was ex-consultant at QRG Health City. In her 7 years of career, she has performed more than 10,000 cataract surgery and more than 1,000 refractive surgery procedures. She's among the few ophthalmologists who practices aesthetic Botox injections certified by American Academy of Aesthetics of Physicians. Dear listeners, I'm sure you're excited for what's in Doctor Speak today. So do like, share, and subscribe our channel and continue listening to us. Welcome to Medicircle, Dr. Saumya Saxena.
Hi, Aprajita. Thank you for having me online.
You're most welcome, ma'am, and it's a pleasure to actually have you. And let's begin with our, short and sweet interview that we're conducting. So my first question to you is, what are the common eye problems in kids?
See, when we come across visual problems in kids, the most common eye problem that we come across regularly is the refractive error. Refractive errors are very common, and this causes blurring of vision, and it can be easily corrected by spectacles. Another one is the myopia, which which is known as lazy eye. A child can have trouble seeing at near distance, far distance, or both. If the child does not see directly for long enough, they can lose vision and get a lazy eye. Third would be strabismus, which we commonly know as squint, which is basically the misalignment of eyes and nothing else. Other less common eye problems include watering of eyes since birth, the allergies and the conjunctivitis that people have, then the white reflex in the eye since birth, which can be associated with other pathologies as well. The second last would be the drooping of eyelids and some nutritional deficiencies.
All right. That's a lot of problems. So are there any specific symptoms of these eye problems? Specifically,
yes.
To know them.
Yes. The constant eye blinking and eye rubbing due to allergies or refractive errors is one of the most common eye symptoms that people or the parents complain with. A child is less likely to tell you of the vision that they have a blurry vision. 3 not so obvious signs of childhood vision problems would be: 1, there's a quick loss of interest in regular activities which require extensive eye use. Second would be losing your place when reading. They must be reading something and they suddenly lose interest. Then turning the head to look at something in front of you. So if you observe one or more of the symptoms in a child, you should better schedule an eye appointment with an ophthalmologist. And often a parent does not come up with signs of strabismus, myopia, or refractive errors, which I just mentioned. Right. That is why it's so important to have a regular eye screening in these critical years of growth. So when we talk about the refractive errors, the 3 main refractive errors that we have is the hyperopia, the myopia, and the amblyopia. The hyperopia, which we commonly see, which is commonly known as farsightedness. The child is able to see or probably able to read well, but is not able to see at distant vision, that is known as short-sightedness or myopia. Then there are conditions when the child is able to see distance but is not able to read pretty well, that is known as hyperopia. And then there is astigmatism, where the near and the far, both the visions are blurry. In case of amblyopia, the child gets a lazy eye. In spite of getting the vision corrected, the child does not have a 6/6 vision. And then there is strabismus, in which the child may look straight ahead, but the eyes might go up and down, or to the other side. So the strabismus needs to be treated as soon as possible. And the healthy vision, the basic need for a healthy vision is both the eyes should work together. So these are the symptoms, that you should actually look into.
Quite well explained, ma'am. Thank you so much. Now that you've said something about 6/6 eyesight, so normally when do we talk about normal eyesight, what exactly are we talking about?
I would, let us start from the beginning, because the initial year, the initial first year of the child is also very important. So the parent should be pretty well aware of, what they need to check in as the child develops. So by the age of 2 months, a baby should be able to focus and follow objects. All right, this is the first sign that the parent should see, okay, fine, the baby is 3 months old now, he's able to focus on something, or probably to, follow the objects around. At the age of around 5 months, the babies are able to perceive depth. So they are able to reach out to objects, they hold them properly, and they develop the depth perception basically. So at around 9 months of age, they are able to, they are able to recognize colors, and they reach out for different colors. So these are the health tips which basically tell the parent that the child is growing well and the visual health is good enough. And of course, by the age of 1 or 2 years, the child is able to recognize objects. And by 2 years and 3 and above, the vision is almost 6/6, and that can be easily dealt with through pediatric charts that we have. So I'm stressing on this fact again and again, that you need to have regular eye checkups for kids.
Normally, people are very averse to going to doctors for normal checkup. Unless and until they find some problem with the child, they do not go to
exactly.
So that's a very, very insightful thing to say.
We usually get parents who come to us, and they are pretty late in coming to us. And we ask them, and they say that the child is pretty small. We do not realize that the child might have any problems. Okay. So from 3 months of age, actually, you should be very critical in analyzing whether the visual growth is good enough or not.
Like all mothers would be interested in, one and foremost thing, that is diet. So which diet would you say that would affect eye vision in children? Does diet?
Of course, yeah, sorry?
I just wanted to emphasize on, does diet actually affect eye vision in children?
Yes, diet basically has a big role in vision development, especially because it contains a lot of vitamins and minerals that are required for the development of the eye and the retina. So we start off with the green leafy vegetables, which every kid just hates having. So green leafy vegetables like kale and cabbage, they are rich in lutein and zeaxanthin. So these are kind of antioxidants which basically help in developing of your retina. Then the foods are foods like fish and other things. They are rich in omega-3 fatty acids. The egg yolk contains vitamin A, which is good for your eyes. Everybody knows that. Almonds, which contain vitamin E, that is good for your ocular surface as such. Dairy products like milk and curd, which is again good in vitamin A and zinc. So vitamin A helps in proper development of eye pigments, and zinc helps in the development of retina. Then there are citrus fruits, which are pretty rich in vitamin C, which is basically good for your corneal health. So yes, the nutritional the nutrition has got a major role in your eye development as well. So I think in Indian scenario, these are pretty much inculcated in the diet. So
Yes,
I don't find an issue with that. Yeah.
thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been real pleasure having you on the show, ma'am. And you have been very succinct and very clear about all the answers. I'm sure everyone has benefited from meeting you. Thank you.
Thank you so much, Aprajita. Thank you. It's all my pleasure. Thanks.